Pharmacy. Hello, my name is Tatum. I'll be your student nurse today. The doctor has ordered me to just go ahead and give you your medications if that's okay with you. All right. And I'm going to pause your answers. 30 seconds. Just gonna say those 30 seconds. All right. And can you confirm your name and date of birth for me? All right. And do you have any allergies? Okay, perfect. We do have that he's allergic to, or she is allergic to amoxicillin, so we have that correct. Birthday was correct. All right. Okay, so Miss Burks, I have your, I just have some medications for you, okay? So the medications that we have, sorry, it's stuck to the thing. All right, Miss Burks, we're gonna be doing a TB skin test on you. You are going to be here for the next 2 or 3 days, so we will have time to check that order within 48 to 72 hours. And then we have our B12, 1,000 micrograms, 1 milliliter. And then I have 10 units of insulin for you. There's that insulin. There's that tuberculin, or vitamin B12, sorry. This is the tuberculin. And then I do also have some diazepam for you, 2.5 milligrams, half a milliliter. Alrighty. And then I have 20 milliliters of Tylenol, 650 milligrams. And then we have your Ofloxacin eye drops. I have your Keflex, 250 milligrams. Your Metformin, 500 milligrams. Prednisone, 10 milligrams. Alright, and then we have a flush for RIV, sorry. Alright, so the first thing I'm going to do is give you your oral medications. So I would have a glass of water. I would want to raise up the bed. I'm going to make sure that there's nothing blocking her airway, nothing preventing her from talking or speaking or swallowing. Make sure that she's not NPO. And then have a glass of water and everything. And I'm going to go ahead and give those oral medications. So I have the prednisone, 10 milligrams. I'm going to give that orally. And then give her glass of water as well each time that I give a medication. Going to give the Keflex with some water, the Metformin with some water as well, and then we're doing Tylenol because she has a fever of 101 and some pain, so we're going to give the Tylenol also with some water. Alrighty. Alright, now Ms. Burks, I'm going to go ahead and do your eye drops if that's okay. So again, the bed would be raised. I would have the patient to lean their head back. I'm going to pull down on the eye, do 5 inches above the eye, and then do 1 drop to both eye as prescribed. Alright, and now we're going to go ahead and give our TB, insulin, IV meds, and our intramuscular as well. So I would want to wash my hands and change my gloves after I've touched like their mouth and eyes and everything. So that's what I'm gonna do. you doing okay, Miss Burks? Okay. I know you don't like needles very much, so I'm going to try to be as gentle and as fast as possible for you, okay? Alright. You're doing great. Yes, so we have to do this TB test because we think that you might have tuberculosis. So all this is a little kind of like bump on your arm, which is where the fluid that's in my syringe will be. And it's basically just going to tell us if you have tuberculosis or not. So we're going to put it in today, and then we'll look at it in 48 hours, and that will be the results. Alrighty. And yes, I do have your insulin. We are going to start with the insulin, actually. I think you can see that. We can do this. See better. Alright, and then I would want to assess or ask them where their last insulin injection was, and not use that site. So we're going to use the abdomen today. We're going to clean 1 inch from the belly button for 30 seconds. Alright. You ready, Miss Brooks? Okay. I'm gonna pinch the skin. Dart in. We're gonna leave this in for 10 seconds. Alrighty, we're going to throw this in the sharps container. We would not recap this, but the sharps container's over there, so I can really can't reach it. Alright, that was great, Miss Burks. We're done with your insulin. I'm going to give your B12 now. Cool. I'm going to clean again, and I would give this in the deltoid. For intramuscular, we can use the deltoid, the ventrogluteal, and the vastus lateralis. The ventrogluteal is more for deep medications that need to go deeper in, but the deltoid, we can use B12 in the deltoid. And for IM injections, we want to use the Z-Track method. Alright. So Z-Track, we're going to pull the skin. We want that needle to go as close to our hand as possible without stabbing ourselves. We want to lift up at the same time. Oh, that just fell. Okay. And then we would just give them a bandage, massage it if we needed to. Alright, now we're going to do our TB skin test. We'll leave that over here. Again, going to clean. And I would be documenting each of these as I went as well. Alright, time for the TB. We're going to go bevel up. We're going to make a little bubble. I don't know if you can see the bubble, but alright, Miss Burks, last thing we're going to do is I'm going to push some IV meds for you. not gonna lie, I do not know the push rate for this, but I would want to know the push rate, which would be on my med cards that I'm gonna have. And I would push the flush at the same rate as the medication. So we're just gonna undo this tape, Miss Burks. Alright, there we go. Okay. I'm gonna unclamp this. I'm gonna clean off the hub. Jeez. Okay. I'm gonna flush. I'm just gonna do 5 milliliters so that I have something to flush with after. Okay. And then we are going to inject the medication at whatever the push rate is. And then we're going to flush again. Before we gave IV meds, we would want to make sure the IV is patent. There was no air bubbles or anything. Alright, and then we would want to clean this again. We're going to secure this back on the arm. We're done with those. Alright, Miss Burks, you did wonderful. That's all the medicines that I have for you right now. Alright, if you need anything, you can press that call light for me. I'll come in here and help you, okay? Do you need anything right now? Are you doing okay? You feeling alright? Good? Okay, I would lower the bed back down, make sure they have their call light. Make sure they didn't need anything. Give them their table so that they can reach it. I'll wash my hands and then leave.